Okay, so welcome everyone. My name is Kayla DeCecco, and I am a community resource worker with Carizon Family and Community Services. And I'm here today with Emily. Emily, would you like to introduce yourself?
Sure. My name's Emily, and I'm a public health nurse with the Region of Waterloo Public Health and Emergency Services. I've worked there for 10 years now, and now I'm working in pregnancy and breastfeeding. So prior to COVID, the COVID pandemic, we ran free breastfeeding clinics in Cambridge and Waterloo, and we helped support Carizon with the Canadian Prenatal Nutrition Program, amongst other things. So now, of course, things look very different. So my role, yeah, very different. Now my role is to help support families virtually with breastfeeding. So it's been interesting navigating that, but lots of fun too.
Perfect. Emily, thank you so much for sharing. So if you've stumbled upon this video, you're probably here to recognize that Carizon is putting together a couple different videos to really help support and bring women together who are currently pregnant, especially during the COVID pandemic. So one of these videos that we're doing today is a question and answer with public health nurse Emily here, as she mentioned, just to kind of go over a couple questions that have come up or questions that you may be wondering or curious about. And the hope is just to sort of shed some light and to provide some information if these are things that currently expectant mothers are curious about or wondering about or thinking about. I myself am also currently 25 weeks pregnant, so this information is very near and dear to me personally as well. So Emily, thank you so much for being with us today. We're very grateful to have you on board and to share some of your expertise and information with our community. So why don't we just dive right in and get to our questions. So the first question we have, Emily, is has research shown anything to suggest that pregnant women are more at risk of contracting COVID-19 or of having severe symptoms if they do get the virus?
Yeah, so COVID-19, as everyone knows, is a fairly new illness. And so we're still learning how it affects pregnant women. Currently, there is no evidence, though, to suggest that pregnant women are at higher risk of COVID-19 and that if they acquire it, of having more serious illness. So,
Right.
yeah.
Good to know. Perfect. So what are additional precautions that a pregnant woman could take in order to limit their risk or exposure to COVID, especially with things like increased prenatal appointments or just those added pieces that a lot of pregnant women find needing to go out into the community in order to attend appointments and those sorts of things?
Yeah, the precautions are the same for pregnant women as the rest of the population. So you definitely want to protect yourself. Um, you know, if you do have additional health risks, such as a weaker immune system, any heart or lung conditions, or diabetes, you may be a little bit higher risk. So I would speak to your family doctor or a physician or your OB about if there's any additional precautions you should be taking if you have a high risk pregnancy. But yeah, the precautions are the same. So stay home as much as possible, except for your important medical appointments. There are lots of physicians now that are doing a lot of appointments virtually or over the telephone. But of course, if they do need to see you in person, which they may need to as you get closer to your due date,
Mm-hmm.
you can wear a mask to your appointment, and some physicians are even requesting that. And then is it possible for other families to do some of those essential trips for you? So could they do your grocery shopping for you? Or can you do maybe some more bulk shopping where you're not having to go out as often? Avoid visitors to your home unless it's for medical purposes.
Mm-hmm.
And then wash your hands often for at least 20 seconds. And if you don't have any soap and water, use your alcohol-based hand sanitizer. Practice your physical distancing. So you want to keep that 2 meters when you are around other people or in a place where there are people. Avoid touching your mouth, nose, eyes, and avoid, another thing is you can avoid touching surfaces that are frequently touched in public places if you are having to go out, or consider even trying to go when it may not be peak time. So can you go like in the evening or a time that it may not be as busy?
Okay. Yeah. Perfect. So what do we know, knowing that there isn't a lot of research out right now, of course, but what do we know so far about the effects of COVID-19 on babies that are in utero?
Yeah, you're right. There's not enough evidence at this time to indicate that mothers can pass COVID-19 to her child while pregnant or while giving birth. But in my opinion, that's reassuring.
Right. Okay. Good to, yeah, for sure.
Yeah.
So the next question.
Country dealing with this too, right? So I think we're monitoring the situation worldwide.
Absolutely. Yeah, for sure. So if I happen to be breastfeeding and I suspected that I may have been infected with COVID-19, should I continue breastfeeding, or what would sort of be some recommendations around that process?
Sure. Yeah. Breastfeeding is recommended when possible. I would say this is a discussion you can have with your physician prior to having your baby too, if you have any concerns or questions about it. But breastfeeding, as we know, has many health benefits, and it does offer protection against infections and illnesses for infants and children. So, yeah, the virus at this time has not been found in breast milk.
Okay.
So yeah, if you're unsure, have a conversation with your physician. If you have tested positive or you think you may have COVID-19 while you're breastfeeding, you can use precautions. Wash your hands often, especially before and after touching your baby or your other children. Practice proper respiratory etiquette, so coughing or sneezing away from your baby or into your sleeve. Wear a mask while you are breastfeeding. So if you're closer than 2 meters with your baby, wear a mask. So while you're feeding, you can wear a mask.
Mm-hmm.
Ensure your environment's clean and disinfected with an improved hard surface disinfectant.
Okay.
And practice physical distancing within your home. So with the exception of your baby. So we still acknowledge skin to skin as being a great way to bond with your baby and establish breastfeeding. And you can stay in the same room as your baby if you prefer. If you're really ill, we encourage you to ask another healthy adult to help out with the caring of your baby. So you could pump and provide that breast milk to another care provider.
Mm-hmm.
And I would suggest that healthy adult wear a mask in your home and wash their hands frequently too.
Okay.
Yeah.
And yeah, that's good to know as well.
Sorry, go ahead.
I was just going to say that so far there's nothing to be said that like the virus transmits through breast milk, because even in conversations I've had with different women, that was like a big thing, like, oh, I don't know. So that's sort of reassuring.
Yes, yeah, it is, absolutely.
Yeah.
There's other things that parents can do too, just to take into consideration while you are breastfeeding. So one of the things you could do is if you're using a breastfeeding pillow, put a clean towel on that breastfeeding pillow every time you're feeding your baby. Or if you're using a breast pump, you can sterilize that equipment every use. And then just try not to share bottles or breast pumps.
Cool. Okay, good to know. The next question is also one that I was really curious about, just because I personally find that the information is changing so often in terms of the process. So if I was pregnant and suspected that I contracted COVID-19 or that I had been around someone who has tested positive, what would my very first step be to do?
Yeah, so the precautions are the same as for everyone else. Again, so you would need to self-isolate if you are symptomatic, even if those symptoms are mild. if you test positive or if you have had close contact with somebody who may have COVID-19 in the last 14 days. So you can go to our Region of Waterloo Public Health website for information on self-screening and testing.
Okay.
And recently, the government has made a change that now anyone with symptoms is eligible for testing. So our website is kept up to date. It's got all the information you need if that is a concern of yours. And then I would suggest talking to your healthcare provider about how it may affect you giving birth if you're closer to your due date, and you're experiencing symptoms. So that's a great conversation to have with your doctor about what are some of the precautions that either your birthing center or hospital may take, or any other concerns that you have.
Yeah. Okay. Good to know.
Yeah, and then consult with experts too, right? So
yeah, very much so.
Yeah.
So the last question that we had sort of prepared is that this situation has really added to fears and worries. So what are some recommendations that you have for how someone who's pregnant could manage their physical and mental health while also being pregnant and everything that kind of comes along with that during this time, which is a world pandemic?
I would say prior to giving birth, it may be helpful to learn about the COVID-19 policies at your local hospital or birthing center regarding visitors and your support and what you may expect, because that can sometimes help to ease some anxiety, just knowing what things may look like when you're going to the hospital or you're ready to give birth. A lot of hospitals are requiring patients to wear masks. If you plan to give birth at home, talk to your midwife about whether this is still a practice and still an option for you, and what are some of the precautions you can take to make sure that your home environment is safe. And then, of course, self-care, right? So practicing self-care is so important, even now while you're pregnant, and even more so once you have that baby. So going for walks while you maintain your physical distance is really great. That exercise can release hormones to help with your stress. And now there's lots of companies that are offering virtual classes too to help support physical health. Like there's yoga classes and things like that you may be able to do from inside your home. Take a bath, eat well, have good nutrition, listen to music or do a hobby that you enjoy. And then make sure you're getting a good amount of sleep. Sleep can help control our mood and our stress tolerance, and sometimes just lets our brain regroup. Reach out to your friends and your family and talk about your concerns and worries. If you need counseling, that's at this time available virtually or by phone. Of course, we know pregnant and postpartum women are a little higher risk for mental health issues, such as perinatal mood disorder, and especially now with everything going on. So it can be normal to experience mood changes during pregnancy and postpartum because it is such a big life change. But just make sure you know what the signs are for perinatal mood disorder, and speak to your doctor if it's becoming a concern. And it's something good for partners and family members, your support person, to be aware of too, what the signs are, so that they can have that conversation if it's something that is becoming a concern, right?
Mm-hmm.
One of the things we always say in our prenatal class when we talk about perinatal mood disorder is, no, you're not alone. There is help, and perinatal mood disorder is not your fault.
Right. Perfect. Emily, I really appreciated your range of responses as well, in terms of speaking to the facts and also just emphasizing having women connect with, again, their OB or their midwife or their family doctor for further information, reviewing hospital policies or procedures potentially as a due date approaches, and that emphasis on community as well. So inner support circles for women to be able to access during this time. I'm just wondering if there was any additional resources or websites or information that you would encourage women to access, or that you wanted to sort of just float by, in addition to kind of some of those pieces we've talked about today.
Yeah, so I would say if you're looking for information about COVID-19, I would go to the Region of Waterloo Public Health and Emergency Services website. It's kept up to date. It's got really great information about COVID-19 and the self-screening, and lots of great links and resources to connect you with more information. There's stuff on there for children, and lots of great resources for managing and coping with stress and coping during this time. So yeah, our website has lots of great information on there. And you can also call our number 519-575-4400 to speak with a public health nurse. For pregnancy and COVID information, you can go to the Public Health Agency of Canada website. That's where I've gotten most of my information from. And then if you're just looking for information about pregnancy, birth, breastfeeding, or caring for your newborn, you can access our free online prenatal program on our website. It's actually really great. Lots of great interactive activities, quizzes, and videos. And it's geared for both pregnant women and your support person.
Perfect. Excellent. So that's exciting. Lots out there to explore potentially to get more information and to continue building up what we kind of know or understand, or what might be helpful tools for women who are pregnant at this time. So Emily, thank you. Those were sort of the questions that we have prepared, and I personally feel that was very helpful, reassuring in a lot of ways, just to kind of get, again, that additional perspective. And I feel really good about learning the different avenues that I can access for more information or for continued support. So that's been really helpful for me. Just before we conclude the video, folks, if you are interested and you're watching this, please feel free to continue to browse around the Carizon website. There's more videos specifically for women who are pregnant at this time. So we have a tapping video or a motion freedom technique video that you can explore just to sort of help manage anxiety or heightened feelings that you might have during this time. There's another video which is more of a discussion of a couple women who are pregnant at this time, just sort of sharing and creating a space to be able to talk about the good things and some of the more challenging things that are bringing out our emotions during this time. So I encourage you to look through the website and to see if there's other videos that are of interest to you. But for this one, thank you again, Emily, for being here. It was so great to chat. Yeah, and we hope that some folks have found this helpful. So thank you, and till next time.